love you like that. Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Good evening, my viewing audience. In with this week's edition of Health Matters, I am your host, Chevany Nisbet, health educator from the Health Promotion Unit. With me this week would be Dr. Richardson and her team of the University of Virginia, and they're going to give us a little more insight on research that they have been doing and what they plan to do next for diabetes 2 and other ailments that are facing the Caribbean region as well as the world on a whole. So here is my interview with Dr. Richardson and her team. So Dr. Richardson, can you please give us an overview of the research that you've been doing and what you will continue to do?
Thank you so much for this opportunity to give you an overview of what we've done here this summer. We've had an amazing time. We've been focusing on type 2 diabetes in a number of ways. One, talking to the general population about what they know about the risk factors and their actual health behavior, as well as looking at data in the clinics to get a sense for where the distribution of diabetes is. And so we'll be able to tell you, the ministry, after we analyze the data, where the pockets of diabetes are and where you have people that are at greatest risk of developing diabetes. So we're quite excited about the ability to share with you an entire database of information.
Okay, thank you. And now I'll turn to the students and ask them some questions. How did you develop a team approach to the research project?
From the get-go, our project is multifaceted. We've tackled this question of type 2 diabetes in a mixed method, and that means that there's plenty of different skills needed to actually do this research. So we have quantitative and qualitative skills, and our students are from a whole different range of majors and backgrounds, so their educational experiences have really contributed to our work in Nevis.
What methods did you use to collect data in the clinics and of the general population?
For our clinic, the study in the clinic, we did a randomized chart review. So we collected the files from all patients who met our inclusion criteria, and then we de-identified them and assigned IDs, and then we collected information from their charts, but it was all de-identified, so you cannot connect any of the information to the patients. And then for the surveys, it was also randomized. We went to public places, the Rams, Charlestown, and we picked random people on the street and asked if they would participate in our survey and gained oral consent. And then we used a World Health Organization instrument for the survey.
What surprised you the most about the experience?
Being on an island is my first time, and so one thing that really surprised me was how it felt being in a new place surrounded by water all the time. So that's what surprised me about Nevis and St. Kitts. One other thing is really the history of St. Kitts and Nevis. I never really looked at the history in depth to see how the Caribbean contributed to what we have now in the world. And so learning about St. Kitts and Nevis and their role during that time was also very surprising and beneficial to me.
What surprised me most about the program was the level of professionalism, detail and accuracy that goes into a project like this, and also the level of work that we have to do, and also the closeness of the group. That also surprised me.
I know you have not completed data analysis, so can you explain your analytical process for the clinics and the general population survey?
So once like Dega said, we collected chart review information and also survey data. The chart review information, once the IDs were assigned, we destroyed the patient's names, so there is no way to connect their identity to their names. And For the chart reviews, we'll be looking at health outcomes, like how many people have hypertension along with diabetes, and we also looked at other comorbidities. And for the survey data, we analyzed different categories such as diet, lifestyle, how much exercise you do, because these are all things that are related to diabetes.
I understand that the entire team is traveling to the University of Virginia on Sunday. What is planned for your week in the U.S.?
So the entire team will they will have some really long days. We'll be waking up for 9 o'clock to start workshops and academic skill building sessions taught by different professors from the University of Virginia who have different skills for public health research, so that we can really start going in depth with our analysis. And then by the end of the week, we should be presenting on that to everyone there, the program, and then sending that data out to the people who we've done the research for.
How has this experience influenced you personally?
I've learned a tremendous amount of skills that I can utilize academically, and not only academically, but I can also use them in the career. Like as I go on in the future in the work field, I know that they can be used, I can use them.
Personally, this program has created for me international friendships that I wouldn't have gotten otherwise. That'll be very beneficial in the future, making professional connections. And also, I've learned a lot of skills, like what was said before, a lot of skills to apply to public health research in the future, or if I want to take another career path, I can definitely apply those skills elsewhere.
Well, this research program has taught me how to be flexible, and as well as to open my doors to career paths that I might have. And also, as Shakira mentioned, have a team that I can look forward to looking at their careers and building relationships.
This has affected me personally by bonding with persons from different cultures, from different places, and it has helped me to build myself better in regards to work, how to work with persons, teamwork, how to do work on a professional level, and it has impacted me on a great level, because this experience has been wonderful, meeting people, friendships as they all mentioned, and it has been fun.
I understand there has been another study on asthma. Could you tell us how this has affected you both educationally and personally?
So we've done a similar study, which was a chart review looking at pediatric asthma, overutilization of the ER here at Alexander Hospital. And we had a similar approach to the chart review of this group, and we de-identified data and then compiled the data set to help inform that distribution and to give the Ministry of Health some evidence as to what proportion of pediatric asthma cases are coming to their emergency room. And as far as how that's affected me professionally, it's been a really beneficial experience to be able to perform public health surveillance, so not just learn about it in the classroom, but to be able to actually do that myself, and with the consultation of the staff at Alexander Hospital and of my professors and faculty, which has been very helpful.
I would be remiss if I didn't thank all of the clinicians and members of the Ministry of Health and the population of Nevis and St. Kitts who have added to the experience not only of the students, but also made it possible for us to have this research experience with United States and Kittitian and Nevisian students. We thank you from the bottom of our hearts, and we are looking forward to the ways in which the data that we've collected and analyzed will advance the health of the people of the Federation. Again, we say thank you so much for hosting us and being so kind to all of us.
I would like to thank Dr. Richardson and her team from the University of Virginia for coming to St. Kitts and Nevis to do research. I can guarantee you that this research, the results from this research will be beneficial and will definitely be used in our future endeavors to promote healthy living and healthy lifestyle here on the island. So we're really grateful that they can come here and visit wonderful Nevis. So everybody's going to tell me something about Nevis that they loved, starting with Dr. Richardson.
My second home.
It's wonderful.
Nevis is my home and I love it.
Sweet mangoes.
It's familiar.
Very welcoming.
It's a community.
It's fabulous. I want to come back.
Nevis is nice.
Nevis is historic.
And Nevis is the gateway to heaven.
And that has been this week's edition of Health Matters. I am your host, Chevin Nisbet, health educator from the Health Promotion Unit. The fruit of the week is mango. Mango is a high source of fiber, so it helps with digestion and lowers cholesterol. It's also good for your skin, and it also contains lots of antioxidants that fight cancer. So please have lots of mangoes, even though I know I don't have to tell the population of Nevis that have some mango every day this week.
Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body. Smoking and drinking will not help. Sniffing and drugs, you'll hurt yourself. You gotta remember to check your blood pressure. You gotta take good care of yourself. Who's gonna love you like that? Taking care of yourself is the love no one else could ever give. Exercise and eating healthy, that's the best thing for your body.
Amongst us, in our homes and close to the food we eat, live some mysterious, tiny, yet extremely energetic creatures. Much smaller. These are microorganisms, extremely small living beings. There are 3 different types of microorganisms. The good ones help to produce foods and drinks such as cheese and yogurt, fermented meat, and fermented vegetables. Some other microorganisms are annoying. These are the bad ones. They are responsible for the foul smell, bad taste, and repulsive look of rotting food. But they normally don't cause diseases. But it's the other kinds of microorganisms that we really need to be afraid of. They don't cause food to smell bad, and they don't change the way it looks. They are the dangerous ones, and it's necessary to be very careful with them. These are known as pathogenic microorganisms, and they can cause severe illnesses, such as stomach pains, vomiting, diarrhea, fever, and even death. They're deceitful, invisible, and dangerous. These tiny beings are very, very prolific. To increase in number, they need food, water, time, and warmth. They can multiply very quickly. Fortunately, no matter how strong and frightening these microorganisms are, they are preventable and vulnerable. It takes as little as 5 simple rules. 5 behavior keys to get rid of them. Protect yourself and your family from diseases in the home. The rules are easy to apply. These are your 5 keys to safer food. Keep clean to prevent contamination. Separate raw and cooked foods to avoid cross-contamination. Cook thoroughly to kill microorganisms. Keep food at safe temperatures, either hot or cold, to prevent bacterial growth. Use safe water and safe raw materials to avoid contamination. Food producers are the ones primarily responsible for the safety of the food you buy. But you can protect yourself and your family from diseases in the home by applying the 5 keys to safer food. Use them. You also have a role to play.